Welcome everyone. Welcome to September site meeting. Again, we are not going to discuss attendance, and we know that enrollment is still low due to COVID or what have you. So we're not going to report on that this month. Hopefully next month. ITER's tip of the month is health practices. So 7.3, positive teaching interactions often experienced by children during health-related practices. So counting fingers, while washing hands, naming steps while you're changing their diaper, helping children look for names on cots, so including them in those health practices. All of those Lakeshore orders should have been received. I know you all have been working hard, unpacking, inventorying, all of that. I appreciate that so much. Some of the PPE health supplies are still being delivered. I know some of that is kind of behind. I know a lot of you have gotten your detergent and things like that, but other things like masks and those items are a little back ordered, a little slower. So keep collecting those. Also save those invoices for us and turn those into your quality mentor, because we need to turn those into OVEC so we can pay those vendors. Please remember to keep all soft toys out of the classroom. This includes those touch and feel books. I don't know if we mentioned that before, but those still have that soft, a duck or things like that. So we do want to put those up as well. Attached will be kind of a first aid requirement checklist, so that we've received from Jennifer and Sarah. I'm going to read through it to you right now, but you need to ask your director for a copy of this so you can kind of inventory yours in your classroom, or your director may want to come in and do it themselves. So just please make sure that this is done. So the first aid kit location is marked and stored out of reach of children. The first aid kit contains bandages, sterile gauze, medical tape, scissors, flashlight with extra batteries, check the date on the batteries, cold packs, thermometer, and covers if needed, biohazard kit for spills, vomit, blood, etc., disposable glove at least in the room and accessible near the first aid kit, liquid soap in the room and out of reach of children, your first aid book. OVEC provided a laminated copy on a ring, so you all should have that. Classroom has a choking and first aid poster. Classroom has a dental emergency guide. It's on a laminated tooth. Travel first aid kit is located in the travel bag out of reach of children and contains at a minimum 2 sets of disposable gloves, 5 small and 5 large band-aids, 1 cold pack, small pack of tissues, baby wipes, and a CPR mask. Travel kit contains the correct number of updated parent, guardian, emergency contact info, so those 1520s you received from your FA. So you will get this. You need to ask your director for it. So when I send them the link to the video and the sign-off sheet, this will be on there. So remind them, Jennifer attached it to that email. So I want you to make sure you're doing this for your classroom. Next, some of you should be receiving a needs assessment from your director. That is a paper that just wants you to rate what teaching practices you're comfortable with. Rate yourself from 1 to 5, 5 being the highest. Yes, I do this, I'm confident in this skill. Or 1, no, I really could use some support in this. Or some more resources. And it's not punitive, it's just for coaching purposes, and it's just for Kathy and I. So we look at those to see if we can support you in any way, or if you need some extra resources from us. So those are going to need to be returned back to your quality mentor by September 28th. So again, ask your director for those. They should have given them some paper copies to distribute to you all. Next is cuddle bags. I'm actually at a site right now, so I can show you one. I'm pretty excited about these, but we were able to purchase a cuddle bag for each early Head Start child, and we have been passing those out this week. Each child will go home with one, even if a child is not attending due to COVID or what have you. We need to get their kit out to them and your FA will work on that with you and your director. But I will show you. Each has a little lovey that is so cute, and packs of books for them to keep at home and read with their parents. So we're really excited about these, and there's a letter in each one to parents explaining what it is and what they can do with those. So we'll need your help passing those out. Make sure they get to every kiddo. So those should be going out this week and next week. Next is the September site visit sign-off is due Friday, October 2nd. So make sure you watch the video, sign the sign-off by October 2nd. Your TSG checkpoints are due September 25th. Kathy and I have been completing those due to COVID. This time you're going to do them, so you need to have some good documentation in there. If that child is not coming, then we need to go in there and put that reason of COVID, okay? 2020 CCP virtual pre-service, that's been going on. That's those 10 hours of TSG and then those Edpuzzle trainings that LVEC has provided you. That is due October 1st, so you should be on doing that. And then the TSG trainings, you need to be printing and saving those certificates to give to your quality mentor so we can turn it into TRIS to make sure you get the credit. The next CCP directors meeting is going to be virtual. It's going to be November 11th at 8:30 in the morning. We have not determined a date for the next program planning committee meeting. Listed in here is your specialists. Nothing has changed there. If you need anything, please reach out to them. Their name and their emails are there. Next, we are on our school readiness goals. So we are working on number 3. Children will use nonverbal communication and oral language or a communication system to express needs and wants and engage others, such as sign language. So, TSG Objective 10A engages in conversation. This can be done through open-ended questions, engaging thinking skills, and meaningful conversations with children. So, an open-ended question will have more than one answer. An example would be, what do we need to make a smoothie? What could we use to build a fence, garage, house, or spaceship? There's multiple answers to those. And then, for example, if you say, what do we need to build a fence to hold our animals? And they may say, blocks. You could say, well, what kind of animals would we have in our fence? So just kind of keep building on that. That's how you have those rich conversations. You engage in conversation. And that kind of brings us to our next objective, which is 10B, uses rules of social rules of language. So being patient in conversation, allow time for them to think, give you an answer, maybe not give you an answer, but allow for that pause for them to have the opportunity. And that back and forth, asking those prompting questions will help you work on that 10B, the social rules of language. Next is curriculum fidelity goal. So we are going to work on number 4. The environment reflects the languages, family backgrounds, home cultures of the children in the classroom. We all do a pretty good job about this. If you've been through an ITERS, your classroom should be pretty set up for this. And that's having those multicultural books out, using music and lyrics in their home language, those soft and safe family community helpers, those dolls we put in a block area, those rubber ones, those are an example of that. And then we should have plenty of display in our viewfinders to reflect various cultures, gender roles, things of that nature. So you all should be doing that, but please make sure your classroom has those items. I think that's it. That's all I have. You guys have a great day, great rest of September, and I think that's it. Thank you.